whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Cherry Live. I'm Dr. Jordan Valrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about Canadian healthcare. Join us as we speak to innovators, industry leaders, and people working to drive the health system forward. All right, today we're talking with Ross Hendin. Ross is a serial entrepreneur now with multiple ventures in the healthcare space and most recently co-founding Physicians First Financial. So Physicians First Financial is a revenue-focused consultancy helping medical practices increase their profits and their bottom lines, and they've been having some incredible successes recently. So Ross, thanks for taking the time to talk with us today.
Yeah, thank you very much for having me on the podcast. Pleasure to be here.
So what was your draw to the healthcare field? What actually got you into this sector in the first place?
Well, man, it's a really long story, and I think we only have an hour, so I'll try to keep it as quick as we can. I was awful in science class. I don't know if my grade 11 science teacher is still around, but he would probably tell you the story. It was my second day in chemistry. He called my mom and he said, "Your son is not gonna pass this year. There's just absolutely no way." I feel like grade 12 math teacher said the same thing. Like, I was not a science student. Even when I go to see the doctor, I'm afraid of needles. I hate blood. Take my blood pressure, and I'm close to fainting. Like, this is just not. There's very little about this practice that's for me. However, I have a very a very personal draw to this to not just Canadian, not just healthcare, but Canadian healthcare. A member of my family, somebody I'm very close to, ended up having a very challenging time, both trying to find access to care in Ottawa and being able to get, the bridge the gap between doctors and lawyers and insurance companies and all of the different things that befall, patients when life happens. And I realized that, we could probably build a place faster than they were going to get into a facility that could help them in Ottawa. And we did, built a facility in 3.5 years, I think, from idea through to opening, and the wait list was about 5. And from the time that Alivio started, I think we'd seen about 6,000 referrals in, before they would have been able to have been seen, at a clinic that would have been, like at the Ottawa hospital. And so that was really it. I think it was mostly frustration and hubris that were the big inspirations.
And then, so operating Alivio, then I imagine there was a ton of just learnings in terms of the behind the scenes, the finance, the admin, the oversight, how you actually manage the place. And then that's what led into actually founding PFF recently then.
Yes, I think that anybody who worked with me over those 10 years would say that of all of the few things that I did right, and I guess really as an entrepreneur you could relate to this too. Of all the things you only have to be right once, but we're all wrong a million times, and so I was wrong all the time about so much stuff, and I think a big chunk of what made the place such a management success was the fact that I was able to stand on the shoulders of giants. Really surround myself with some bright people along the way and learn. As we made mistakes, as the practice grew, there was a lot that we got to understand, not just about management in healthcare, but actually about management in every other type of business. The inspirations for Alivio, and I think big reasons why it used to grow, was that it was never modeled after a healthcare practice at all. It was actually modeled in terms of its clinical flow, airports and hotels. Airports and hotels are where I spent a good chunk of the first half of my life. And, in watching them and in sitting with, friends and parents of friends who had worked in senior levels in, printing presses and factories, I got a sense of exactly what you do to make sure that, you put the right ingredients in the right place and in the right order, and you end up being able to actually deliver fantastic quality, in a way that's not just efficient, but effective. And, what PFF does is it brings a lot of what was right, a lot of what we learned at growing a business from vision to, 22,000 encounters a year, and offers those, to other clinics so that they can, ideally, not have to make all the same mistakes and just be able to focus on what really matters, right, to grow.
And so one of the things I think is really cool is you guys are actually getting involved in the clinical operations, sort of doing that back end audit. It's not just billing, it's not just accounting on the back end. You guys are actually changing how clinics and offices manage their patient flow and what types of appointments they should be focusing on and what their revenue drivers are. Like, how did you wind up coming to that model versus the traditional get involved on the billing side?
Well, I mean, I guess, to answer the question with your question, there's a lot of people that are just involved in the billing side, and it doesn't fix healthcare, right? Like we built Alivio to really fix and improve the way that the world manages pain, and I think to a huge extent we did that. And we published studies. We allowed people from all over the world to come in, photograph, take and understand the schematics for EMR. I've consulted for, health systems and health entrepreneurs in different places, and it sometimes just helped, groups start up. Like I've been involved in, at this point in more than one clinic group, and very glad to say that, the learnings from all of this stuff, they transpose, right? They go to different things. So, yes, we could build a billing business. There's 100 billing businesses. Some of them are great. Some of them obviously aren't. There's no regulation in that space. There's a lot of people who go to, do a course and then just say they're in the billing business. There's no accountability. But, doctors and clinics don't need that, right? What do they really need? What do doctors really? I mean, you know very well, right? What do you need when you graduate medical school? Well, what you need is a little bit of a sounding board. What you need is a guidance. What you need is a vision to say, I want to build this. I want to build a brand that's meaningful in pediatric care. I want to build, a woman's clinic that actually helps women to not just be great physically, but be strong mentally. Where do I start? How do I do that? What is the right medical record system? How should I be billing? What happens with, third-party benefits versus, disability claims? And so being able to offer some of that experience and share it with other clinics is a huge part of what brings our team joy. And at this point, I think we're really fortunate. We've got some wonderful, very unusually experienced executives and leaders and veterans of the space who've helped to grow businesses that are OHIP focused or, multidisciplinary practices or practices plus products that leverage the brands. People that have come from some of the top business schools and built some of the coolest, clinic operations and businesses in the country working with us now. And I think that really does make all of this stuff very exciting. We're more than just a finance business. We don't just do, cash flows. We don't just do helping with investments. We don't just do making sure your revenue's right and dashboards. We really do want to make sure that you're succeeding in your business so that you can continue to help more people. And that's really, I think the biggest value that we get to bring to clients and the biggest value that I get to get from my experience.
And so you pointed something interesting out there. We finish our training and then we're gung ho to get in there and start the business. But often there's a lot of those core fundamental pieces missing. And, you're bringing to the table the passion and the medicine and the enthusiasm. But there's a whole lot of stuff that needs to go into the mix in order to create a successful clinical business and a brand. Like, what are some of the most common things you see medical practices doing wrong? I'm sure there's a long list of things here, but what are those biggest ones that we're just blind to?
I want to add a lot of value to your audience, and so I'm going to tell you some of the things that are wrong, but I really want to share the things that everybody has to make sure are right, because making sure that you have things right is such an important component as opposed to just identifying the stuff that's wrong. Everybody has their own problems. Every single professional service business, in a way, is a reflection of the founder or the manager's challenges, right, and their gifts. It is very rare that you find somebody who's able to just take their own shit, leave it at the door, and just get the work done that needs to get done. But what goes right? What are the things that I would say that I've seen that are absolutely amazing? When a physician or a leader has a very clear vision and focus of what it is they want to do, that's the best. If you can, as you know, right, as an entrepreneur or doctor, when you say, I'm building Cherry Health, I'm building a place, I'm building the marketplace for locum physicians to be able to actually find a source of truth, right? Forget 16 classified ads, one website where everybody can go and find their job. That is my vision. Who's with me? That is something that's totally critical in healthcare, right? When you're going to build a family practice that's focused on just doing your provincial stuff. I'm just going to do a walk-in clinic that's focused on low overheads, high turnover. Or you're going to build the next, executive health center with annual assessments that's top-notch. Or you're going to build, the biggest, most safe and comfortable pain group in BC. Whatever it is that you're doing, if you're really clear on that vision and you share it with people, that is an absolutely important place to start. And then two, is the mission of the business, right? The vision may be, for Cherry to be the number one place that your, physicians should come in the country. But the mission, what is it that we're doing and where are we starting? Being really, really clear with that is also super important. Sharing your values, making sure that whenever you're interviewing anybody, it doesn't matter if they're folding the scrubs or, doing the interventions or managing the facility. What are their values? Are your values clearly communicated? Are you communicating those values every day? I used to think it was the hokiest thing in the world to say, but if people are aligned on values, they can be very different and still get along well enough to work as a very meaningful, stronger team. If people don't have the right values or they're not totally aligned, they could be best friends and end up fighting and not being able to function. And I think that's something that's totally critical to get right. And then I think, the next thing that's really critical to get right is structured accountability. If you don't have the ability to have your door open in your finance department, be able to make your mistakes or do things, with real transparency and accountability to your team or to your investors or to your partners, that is something that's a really important red flag. Trust has to be there. And if you have a door open policy on everything, so everybody can see exactly what's happening, odds are they probably won't bother, but it really does create an important fundamental element in this type of business, and that is trust and transparency, right? So the businesses that are open to holding themselves accountable, the leaders that hold themselves accountable, and if they're not able to be accountable, like I'm not always the strongest on structure, but knowing that and then making sure that someone who's very good at that is able to do that piece, those are things that add a huge amount of value to a practice. And I suppose, making sure that you have the right tools in place is always, I think that's almost a given, right? You want to have the right ultrasound machine. You want to have the right, the right cable, whether it's a hydraulic or it's fixed. You want to make sure that if you're going to use image equipment, it's always top notch. It's always well certified. You do the same thing with your management tools. What I find is that physicians often, because they're not trained on those pieces of equipment, they're trained on a fluoro, but they're not trained on an EMR. They're not trained on QuickBooks. They don't necessarily understand how that piece works. And so I'd say, a real pillar, like a fundamental pillar of understanding how to thrive in your professional service business is also making sure that you really understand how to read an income statement, how to read a balance sheet, how to ask questions about, how much money is coming in and when is it coming in, right? There's a huge difference between profit and cash flow. Things like that, I think, are really critical questions to ask. And I guess to go a step further, if I was a physician and I was interviewing at a clinic, those are questions I would want to ask, right? Like in Ontario, as an example, doctors, OHIP pays on the 15th of the month. Great. Okay. Well, if we know that, what's the profitability like of this practice? Is it going to be around in a year? And what's the cash flow like in this practice? Do I ever have to worry that they're going to dip into my overheads? Or are the operating lines reasonable? Are they saving money for rainy days? Is there cash in the practice? In my experience, I would much rather pay 5% more overhead to a group that's well managed, well organized, has cash in the bank, and is well staffed, than save the 5 points and worry about what corners they're cutting because I'm not paying enough to keep them running well.
What's a typical actual profitability margin for a well-run clinic or compared to the average clinic? Like, what is the actual upside there to have your machine well-oiled?
Wow. Well, how long is a piece of string? I'll give you a couple of examples, and maybe that'll help to answer the question. I say often to people who ask, it's never about the percentage that you pay in overhead. It's always about the dollar amount that you get at the end of the day. And for practices that are well managed, they'll be able to say to you, at 25% or 20% overhead, we can't afford the anesthesia assistant. We can't afford the nurse that can do a lot of the work under the Delegated Care Act. We can't afford the things that you need to be able to get your clinical flow up from, let's say, 2 to 3 or 3 to 4 patients an hour, or, from 3 to 6 patients an hour, and make sure that we're delivering that the caliber of care that the patient demands, to the patient as well. In a well-run clinic, and it's a bit of a loaded question because it would depend on things like, where is the clinic located? How big is the clinic? How fancy is the clinic office building? I would, like when I get asked where would I build, I would always build in a third-rate building and build a first-class facility, because on the grand scheme of things, especially if you're on the main floor, it is much, much, much cheaper in the long run to do it that way than to build in a Class A building it's got a ton of traffic and have to keep up with the other tenants, knowing that monthly, nut that you've got to pay out is 2 or 3 or 4 times the size. It just adds a very different level of pressure. But coming back to your question about margins, ideally, I'm making more cash, more revenue, more money for me at the end of the month, and the clinic is running at a minimum an 8 to 10% net margin, and ideally a 12 to 15% net margin. I always want to pay groups that are doing very well, because what it means is that if I ever have an issue, I know that they're there. If there's ever an issue that comes up in the practice that's out of my control, they're not skating and skimming. They're able to deal with it in a way that's quick and effective, and their profitability is disproportionately more important than mine, right? I make enough money as a physician that, if I miss an hour or two, it's annoying, but it's not, ideally, it's not life or death. When you're dealing with an overhead split, that efficiency and that uptime is a lot like a factory. Every second that you're not working, it often is really difficult for the clinic, right? Clinics generally will make their profit at that top 20% of efficiency. If you're running a clinic or you're in a clinic and that clinic is, 60, 70% capacity, and they can get to 80%, but there's just a couple of hurdles in the way, if you make the effort to help them get to that 80%, their lives are monumentally better. And the impact to you is only that you're going along for the ride.
Is bigger better? Like just in terms of more volume, more doctors, more patients, does that tend to just scale nicely and linearly or exponentially even? Or is there like an ideal size of clinic that you've come across?
Totally great question too. No, there is no ideal size of clinic or practice. There is no necessary sweet spot. It depends on the type of practice, the staffing model, how things are set up. Are patients well prepared going into the practice? Have they been primed on what to do, what to wear, how to change, how to change clothes if it's a surgical center, there's some type of intervention. The clinical flow is the biggest. I would say if there was a performance indicator, if there was one thing I could look around and tell this place is doing well or this isn't, it's cleanliness and clinical flow. If there's a wait room that isn't too busy, that everybody's organized, the schedule's running on time, it looks good, everybody's happy and smiling, and things are really moving well, that's a place that's making money. It can always be busier, but when it's too busy, what happens is that the staff are strained and they may not be too happy about it. The patients will get upset. They won't necessarily come back and they won't tell their friends. And what that means is that over the long run, that business won't be sustainable the way it is, right? They might be running too fast or too hard. And if they're running too fast and too hard, and it seems like they're not making enough money, what that would tell me is that the overheads are actually too low.
This show is brought to you by Cherry Health, Canada's medical network where healthcare practitioners connect. Physicians, pharmacists, nurses, chiropractors, and all other healthcare professionals can sign up for free, start connecting, messaging with colleagues, or checking out job opportunities posted by thousands of employers across Canada. With dozens of healthcare-specific job filters and search options, we make it easy to advance your career, find your dream job, or line up your next locum with hundreds of new jobs posted every week. www.cherry.health to get connected today.
And again, I cannot tell people enough, and it sounds totally counterintuitive, but if the overheads are too low and that business is killing itself to be able to break even or, make a 4 or 5, even an 8% margin, you would never work on an 8% margin. So asking the partner that you trust with your time, your reputation, your patients, all of your medical records and everything to do that it's not sustainable, right? And I think that that's a huge issue with our healthcare system. So when I'm looking at a clinic, I always want to make sure that the place is clean, staff have nice aligned, views, and that on the right clinical days, and especially the days where I'll be the critical mass and I'll add value, it's well staffed, it's reasonably well organized, and I know that I can have a full day without running, to a place of panic and sweat.
How does an engagement with Physicians First Financial typically work? Like if somebody does want to get in touch, how do you typically operate? What's that like?
Great question too. Everybody's different. Usually the way it works is, we've got a whole onboarding process and a nice structured format, but everybody's different. We very often get calls from our friends, from our friends introducing us. And the referrals, can be one of 3 or 4 different things. So, hey, I have a friend, they're really in a tough place. Can you just chat with them for an hour? Or, there's a clinic and it's about to shut down. They just talked to, their insolvency lawyer, or, they've just called the receiver. they don't know what to do and they're completely panicked and freaked out. Can you give them a shout and just talk to them a little bit about that experience? Then there's the other one. I've opened a clinic, or I'm about to open a clinic. There's no manual for this. There's no clinics for dummies. Can you call, help? Right? I don't know what to do, and please help. And then there's all kinds of groups that are in between, right? There's groups that want to buy groups of clinics. There's groups that want to sell, right, and maybe move on or find a way to be able to get some money out of their business. And they'll call and they'll just ask, like, what do you think this could be worth? And if you were going to look at helping me with this type of a transaction, how would you do it, and what can I expect? And so generally it starts with an email or a call, and generally the call is, I'm just not too sure about this, and can you help? In every single business we've worked with, right? And I say business as opposed to practice, but most of them, obviously are practices. In every business we've worked with, what we've done is gone in, taken a look at their operations, like just how the clinic functions, what the policies are looking like, and who actually reads that manual or listens to the videos, and who's doing what they should and how. And we just give them a little bit of an audit. And we say, if we were going to work together, these are the things that we've noticed. These are revenue opportunities. These are opportunities to be able to improve on some of the operations, if there's anything that pops up. And, in terms of your cash flow, these are some thoughts on what you can do to be able to try to smooth that out. If they want to work with us, we generally do it on a percentage of revenue, because the larger the clinic, the more the resources are that we would bring to the table to be able to help. And we'll work with clinics of any size. So, we work with AFPs, that have, fee splits with hospitals. We work with, I think our smallest clinical group is one physician, and his partner, who've got, some very big dreams, and they're great. Like, they're a great team, and we're very excited to watch them grow. And so, for them, it's literally coming in, we call it a claims cleanup, but just helping to be able to identify the revenue opportunities that are both in the provincial system and then private. And then, using our dashboard. So we have 3 systems. There's a cash concierge, which basically, allows us, if you work on a Monday, it allows us to be able to put cash in clinic account or in your account as a physician and split that overhead in real time within 48 hours. So you can work on a Monday, have cash on Wednesday. Then there's the clarity concierge, and that just helps every business, owner, operator, manager find clarity in their business. And it doesn't even have to be a clinic owner. Sometimes doctors call and they're looking for a hand. So, things from, I want to diversify my revenue and I'd like to look at other opportunities outside of practice, to, can you introduce us to more physicians? Or, this is how our partnership came about, right? One of our clients was looking to figure out how they could find more physicians in the GTA to be able to do home visits. And so we reached out to you. The idea of being able to have a dashboard, like a nice, clear information set that combines with a wealth of contacts and experience. Just like when you go to a hotel, there's a concierge there. You could say, where should I go to eat? This is where I am, and this is what I like. Please work your magic and get me into the right hands. That's exactly what we do. We help clinics and doctors get into the best hands. We never take any kickback or financial flow for those recommendations or for those introductions. We always try to make sure that people are with the best suited people for them. And we use the dashboarding as a nice set of metrics, right, to make sure that the business is actually functioning well, or to keep an eye on the things that need to improve. And then the claims concierge, which is, sort of, as you put it, the more standard bread and butter type stuff. We've got a wonderful claims partner. And we always, we're always looking for great claims partners across North America, to be able to partner with. And the idea is that we put our technology together with their experience and skill set. We use our tech to be able to look at the medical record system, and look at the Medicare system where they are, and the other payment systems, spot the errors, spot the opportunities, spot the patterns, and then ensure that if a patient is missing a claim, or a doctor's forgotten a chart or forgotten a claim, we can flag it if there's a premium opportunity. So, for example, if a diabetic patient should be seen 4 times in a year, or, they happen to be very high maintenance and they're coming in all the time, it's a complex patient, and there's an annual premium that's legitimately available to a physician for that. We track those, right? And we flag them for the physicians, and we're able to automate the billing. And so there is no client that we've had yet, to date, touch wood, but there is no client that hasn't made less than 20 to 40% more top-line revenue net of our fees.
Wow.
Having with us. Yeah. The
Is
biggest
there
fee
any?
is actually 100%. We're working with a physician who literally doubled their income when they started working with us, net of our fees.
Just by modifying their processes. That's wild.
Literally, like it was as easy as, you're starting like this. We'd like you now to complete these cue cards instead of filling out your chart like that, and send them to us in a way that's simple for you. Great. And now we're using our dashboard to be able to monitor and cross-check the way that they're doing the plans and organizing. And this particular physician recently remarried. He and his partner had a vision of spending Saturday nights going on dates instead of filling out all of their submissions. Now Saturday nights they're out for dinner every week, and that's one of the other success stories that makes us really happy, right? They've gotten a chunk of their life back and 108% return. So net of our fees, just a little bit over 100%.
What was that person doing? Like, there had to be some egregious bottleneck in the workflow. What the heck was actually going on that you were like, okay, we got to flip that on its head?
Well, you know what? I don't really want to. I don't really want to tell you what they're doing wrong. It's not really respectful to say anything. Especially if they or the group are watching. However, I am happy to say that as a result of that, there are a few things that every doctor should make sure that they do. One, talk to 3 or 4 colleagues about how they're setting up their billing and their claims and making sure that everybody's doing, even if it's all wrong, at least doing the same thing, so that they're not way off base. 2, if you're practicing in a specialty, make sure that OHIP, if you're in Ontario, or AHS, or whomever your Medicare group is, knows the specialty that you're in, and also make sure that you have the right regulatory certification to be in that specialty. Don't just assume that because you're a GP, you started here and now you're there, that everybody's cool with that. No, you may be a physician, but you're definitely not above regulations in the law. Do your homework and make sure that you have your certifications right. 3, if you're gonna chart, like take time to actually chart. Like, take time to chart meaningfully. Chart the time that you saw the patient. Chart the duration of the encounter. Chart a proper SOAP note. When you walk in to see a patient, use an AIDIT. Properly acknowledge them. Introduce yourself. Explain the duration of your encounter. Ask them if they have any questions and thank them. Things like this, when you document them, actually can translate into defendable billing that generates what it is that you're supposed to make. And if you don't do that, if you run from room to room, or you're so busy you forget to do the part of your job that every professional needs to do, right, which is properly manage your patient and then chart and then claim and then get paid, you're not really in business. So I think that is probably the best advice I could give for anybody who's finding themselves a little bit low on the revenue side and not sure what to do. If you think about it like that, you have to be the type of professional that you would expect to pay for, right? You expect a certain level of service from your accountant. You expect a certain level of service from your lawyers. And could you imagine if your lawyer treated you like, hey, listen, you've got 8 minutes. I'm going to bill you based on this, this, and this. Here's what I've said to you. And so basically, I'm just going to bill you for that. I'm not going to take accurate notes in docket time, but I do need your card. And if you have another question, you have to come back, right? Like, if that's the way that you are actually, like, you would never stay with a lawyer who's going to be treated like that. So if you treat your practice as a business and you treat your business with real integrity and care, your revenue, and your revenue opportunities and your professional opportunities, they'll follow.
Yeah, the customer service mindset is often very lacking in healthcare because there isn't like a direct fiduciary duty to the customer that way. And so it's often thought of secondarily.
Well, it's customer service is a funny one, right, doctor? And you can appreciate this. You're not there to kiss their butt. You're there to give them tough news and tell them what's actually happening. But you have to do it in a way that they feel heard and respected, and ultimately you can do that in the time of the clinical encounter allotment. And that's a very difficult thing. And it, just like business education, there's very little support for this stuff in school. And so when you come out, and I've met a few, clients and potential clients, just friends who connect to ask advice. The burnout rate is massive because you may know what you know about medicine, but you've never been taught how to tell a patient from the outset, we've got 10 minutes, all yours for those 10 minutes. And I really do want to help you. I'm not your therapist. I'm here to be able to help guide you through all of this. And I know that this news is difficult, or I know that this is a challenge. I do appreciate having you here, and I do appreciate what you're going through. Let's figure out what's next, and let's then get there. Thank you. I appreciate your trust. people, when they don't know how to do that, it becomes very challenging. And then if they don't chart in a way that other people can read it and understand it, it becomes hugely challenging because it becomes then, a bigger issue in healthcare, right? And I don't know. I think every professional service person has a difficult time docketing or charting, right? Not to the same extent, for sure. Like the onus and the responsibility that's on doctors is second to no one else, like period. However, as a professional service business person, we all have a responsibility to work on our businesses as well as in our practices.
And so, in terms of like the growth of the organization, what's the long-term vision then? Like right now, you guys are doing revenue and finances and this consulting side of things. So where do you see it going over the next decade?
Well, a loaded question, and I think that's a more of an off-the-record kind of conversation. I think right now what we'd really like to do, and the place that we're hell-bent on going, services notwithstanding, is meaningfully fixing and doing what we can to fix Canadian healthcare. We see a huge opportunity in just helping doctors and helping clinics actually stay open and thrive. We're not out to gouge. We're out to make sure that you have the tools that you need in a meaningful way to keep going right, keep going well, and keep your sanity. And we have, as a business interest, as well as a community service interest, a real goal to helping get new doctors into Canada, giving the tools they need to be able to actually practice meaningfully. And you can see on our website too. It's a bit of a service initiative we call the Road to 1,000 Doctors. Ultimately for us, success in our vision of helping make sure that the Canadian public healthcare system is actually serviceable. That, my family don't need to go to an emergency room and wait 15 hours because there is no one else around who can see them, and make sure that the people who do see them are comfortable, if not happy. That to me is probably one of the most worthwhile ways I can spend my time, and that's really the vision for the business. The services and the way we're going to help, those doctors and those clinics, as they continue to figure out what's next. We'll continue to evolve as we understand how to better help them to not just stay open, but stay feasible and grow.
And so, dealing with all these clinics, all these doctors, as an entrepreneur, a business owner yourself, what was the best day and what was the worst day?
Great question.
It's a tough one. Yeah, both opposite ends of the spectrum. Time when it was going really well, and then the time where everything was blowing up and falling apart.
I can't give you a worst day story because I think it's just honestly too graphic and too tough. Aside from the fact that we get called into some pretty tough situations. The things that we see when things are going sideways are truly brutal, and the things that I've been through in my journey are, they're, I would say that they're generally the worst nightmare for both entrepreneurs and people that are in the clinic business. I would say that there's very little that I haven't seen at this point, short of very graphic physical things happening, to me or in front of me. There's very little that I haven't seen in the way of tough things. We've dealt with fires, we've dealt with floods, we've dealt with, like our old landlord once tried to shank somebody in the hall. Like, one of our patient's drivers had a heart attack in our waiting room. I'm trying to, what else was there? I mean, floods to the point where there were inches of water right on the floor, and the insurance company came in, and the remediation group was trying to rip holes in more walls. We had a lady who, unfortunately didn't disclose medication issues, and she had a cardiac challenge, in the practice. And notwithstanding the fact that when the EMS showed up, they literally shook my hand and said, if we were going to crash anywhere outside of a hospital, we'd want to crash with your team. This is the best run medical group I've literally ever seen, which was great. Didn't stop the patient from trying to extort us for, I don't remember, it was 10 or 20K to, not sue the physicians and not sue the clinic, and everything in between, right? Audits, fights with government. I've literally negotiated with the heads of the, with OHIP, because I'm not a member of the OMA, I don't have to deal with those channels, and I don't know if that's a good or bad thing, but those are all challenges that I wouldn't say I've all faced successfully, but we've certainly given our best shot. In terms of tough days with clinics and clients, I could share a few. All of them, I think, would relate to imminent closure and what happens to patients and what happens to the physicians and what happens to the physicians who signed on the dotted line, as a result of that. Best days. I think there's been some great ones. There's been some really, really great ones. We started working with a practice that, when we started with them, and it's not an unusual story, when we started with them, like the owners were very upset because they thought their days were numbered. I mean, the bank had sort of said the days are numbered and they weren't sure what to do. And that group, fast forward 3 months, revenue is up 20%, 25%, top line net of our fees. We immediately, we started giving physicians that work in the group very, very clear, transparent statements, told everybody what we were going to do and exactly how we were going to do it. I actually have a case study on this on our website. Very, very clear, right? We started with explaining to everybody exactly what we're going to do. Doctor, great to meet you. You're extremely talented. I know that this has been a difficult time. Here's what happens as of tomorrow. You start getting access to financial statements in real time. You can see exactly what you built. You can see exactly what's going to be deducted as overhead. You can see exactly what your taxes are, exactly what your premiums are. Oh, and by the way, you're going to start to get paid pretty much immediately from here on out. So if you don't leave and you stay, you have zero risk of worrying about if your money is going to be here at the end of the month. There's no question. It's coming ahead of the overhead payment. From there, making sure that the revenue recognition was right in the books, but also making sure that the claims were right, made an immediate top line bump to the physicians and to the clinic. And what that meant was immediate confidence. Not only did we say what we were going to do and then do it, but we said what we were going to do, we did it, and there's more money. Using that and keeping the communication right and keeping the trust right, we were able to help to mentor the management group on the nuts and bolts of how to be able to actually, cut some costs, make some lifestyle adjustments and focus on who their real customer is, right? The clinic's customer is almost, in a lot of cases, it's more the doctor than the patient. You have to take care of the patient. The patient is what is the fuel, but the physicians are really the group, right? And so focused on them, made sure that we did everything we said we were going to do the way that we said we were going to do it. And as a result, I think within 3 or 4 months, physicians started telling friends, and that business should be three or four times the size it was when we started with them within about a year of getting going. And I think when you think about the number of patients that place is helping, today on a daily or monthly basis, that they wouldn't have been able to if it wasn't for us. And we see those numbers, right? They pop into our dashboard. Sometimes when I think things are a little tough and I'm a little tired, I look at that number and I remember there's thousands of people that are getting seen because of us, and that really makes my day.
Yeah, you help the helpers, and that impact really echoes throughout the entire system.
It's the coolest part, right? It's the coolest part. And it's funny, like we're both entrepreneurs, and you can appreciate that when you're really desperate for something. There's I had an uncle who used to say once that there was times in life when there's a dime is worth $1 and other times where $1 is worth a dime. A lot of times people come to us and they just don't know what to do next. They need to grow, they need to build, and they're within 5 to 10% of profitability. And that's a great opportunity because they're always super keen and ready to roll. As the business gets bigger and the challenges get bigger, and of course the revenue grows, the appetite and the question always is, well, do we really need to keep you, and do we really need to continue to work on this partnership? And so there's usually a fork in the road. And what we found is that at the end of the day, very few clinics leave, because even if we're costing a lot, we're able to put a lot of value back into the practice, because of course the bigger the practice gets, the more sophisticated the support that's needed, and ultimately I think that's also where a lot of the value can come from.
Yeah, the continued growth leads to continual opportunities for improvement.
Yeah. I mean, there's just not a lot of people in Canada, that are doing what we're doing, which is just focusing on really being the resource for clinics, and then doing it with people who have seen businesses grow well beyond 8 figures in top line.
So you've been in an administrative leadership role, mentoring role, now not just in your own organizations, but across different ones. Who do you look up to? Do you have a role model, or where do you get a lot of your learnings from, apart from trial and error and the school of hard knocks? As I said before, I totally stand on the shoulders of giants.
I'm very lucky. I have, a wonderful, uncle, very, very, very close, very, very close family friends. I've had a mentor for, I guess the better part of 30 years, passed away a couple of years ago, but there was a very, very bright, talented, tenacious, savvy, communicator and business person who taught me a ton. I wasn't really great in school, but I was very fortunate to meet a couple of decent teachers along the way. And, I'm a part of a couple of, CEO and peer, I would say mentorship and professional and social groups. Um, and I often bring questions and challenges to them. Of course, I have tons, and the ideas that I get, and the advice and the wisdom that I get, the experience share that I get from those groups is, it's amazing. I'm also very lucky, like our team, across all the businesses that I'm fortunate enough to be a part of. The team are just so bright, and they all get, and they all get my talents. I'm very good at a couple things, and I'm really awful at a bunch of other things. And I think a big key to success, whatever success is or means, is knowing not just your strengths, but knowing your weaknesses and making sure that there's people around that you can trust. Making sure that there's accountability there, and then making sure that they're able to do the things that you really shouldn't you shouldn't be doing. But getting out of the way, I think, is a key component of it. And the mentors that I've had have done their best to not micromanage, and to make sure that the one team, one dream vision really can be realized.
It's kind of funny because there's different mentality in healthcare when it comes to the weaknesses versus the business side of things. And so in medicine, you're doing your training, and whatever your weaknesses are and your spots where you're not as knowledgeable or confident, right? There's just a huge push, like, okay, well, we got to touch that up and get you better at that, right? Because otherwise there's going to be danger and downstream impacts to care. Versus in the business world, it's like, let's just hire somebody who with a complementary skill set so you can focus doing what you're good at, and then the weaknesses aren't as relevant because you have a team around working together to actually accomplish those goals, and it winds up just being that much more efficient.
Well, I mean, yes and no, right? Like on the one hand, sure, but then on the other hand, every good surgeon needs the anesthesia team, right? And the anesthesiologist is like the bassist in the band. Like, they're so important. And whenever they talk to the patient always asks, "So when's my doctor going to show up?" Right? Like it's a very needed complementary. Yeah, it's a very needed complementary function, and it's just always so totally overlooked. And the thing that's great about your practice that does not work in our world, right? And I'm sure you've seen, and I can't wait to have you on our podcast, because this is when you're going to be in the, you get to be in the hot seat and I get to ask you these questions. But like you've seen in the business world, lots of people not willing to actually do their part and pull what they need to pull and do what they need to do. When you're on the ward, you're in the practice, and you're doing multidisciplinary care, you need to rely on somebody in the ER to be able to be there with you. They don't have to be your friend. You can hate their guts, but and you can count on them doing their job the best way they can and working with you the best way they can. And they won't put the politics ahead of making sure that patient is okay. I think, in a lot of ways, you're very lucky that you get to work with teams that have to function together and have been trained to function together. Where, in our business, I've seen it in my own, and I've seen it with tons of business partners, right? Like business partners can tell you that they've got your best interest at heart, and they don't, right? They're watching after themselves. They've got their own interests. They've got their own agenda. It reminds me a lot of, this is probably not something we want to actually have on, I don't know if you can clip this, but, it reminds me a lot of people talking about faith. When you see two Christians who just totally believe in faith, right? And they just see it from totally different places. Like look at Ireland. Like, what a great example, right? Catholics and Protestants, violent opposition to the same religion, same fundamental beliefs. In business, it's very difficult to find people who have your values, have your sense of integrity, and are willing to work with you in a way that you can actually work. So I think, like, it's not just about the strategy; it's also about the people, right? And making sure that you pick well.
Vision, the values. No, that's all crucial to going correctly, right? Because the sun, moon, and stars all need to align.
Yeah, and the wind's got to be right, and you got to real hard, and hope, right? Like you gotta, you can't, you don't have to be a person of faith, but you gotta believe. Yeah, opening a clinic is not for the faint of heart. There's no question about it. It's like a restaurant. Easier, I think, in a couple ways, but a lot harder, in many more.
If somebody's wanting to get their revenue and finances audited and optimized, where can they find you? What's the next steps?
Next steps are, we're on social. I can't say I'm a great Instagrammer, but you can definitely message us on Instagram, and you can send us an email. You can find us on the web at physiciansfirstfinancial.com. And I think one thing that I will mention, because I didn't talk about, sort of enough, but there's a lot of people who come to our world, and I know, come to your world too, who are just like, just scraping by. And we didn't talk at all about financing and finance structures and the way that banks work and the way that, MD Financial works as opposed to other, investment groups, and ways that physicians can, add a little bit more revenue and make sure that they keep cash, in hand. Is it okay if I spend a minute or two just talking about that?
Yeah.
I was really inspired to spend some time with you and to start spending more time with Cherry when two things happened, right? First one was, of course, that, I met Alita and had a chance to chat with her a little bit and realized that a lot of the people that are coming to Cherry are coming because they need more money. They need to figure out what to do next. They're looking for their next opportunity, and they're cash strapped. And doctors can be cash strapped, right? When you come out of school, you come out with $200,000 to $300,000 in debt. You come out with a 20-year amortization schedule on your student loan at, prime minus 1% or something. You get a $2 million line to go buy a condo or blow on some other depreciating asset. You get an operating line for whatever it is that you need, and you don't really know what to do with them. So maybe you lease a fancy car. Maybe you try to figure out how to refinance your, whatever it is. But very few physicians are actually meaningfully invested in the right types of investments, A, and B, no one teaches you how to be able to figure out how to manage your cash and bring in enough of it reasonably. And so, when Alita started to share with me that a bunch of clinics call and say, I need doctors right away, like right away, we're in real trouble. It occurred to me that if they're in real trouble, what it means is that the banks aren't necessarily helping them to, keep their financials running well. There is no support for them to be able to understand what the right steps are. And especially for the physicians, like nobody tells you, this is how you find clinical research work. This is how you get into med-legal work. This is how you can get out of dealing with Medicare. This is how you can bill private services. Nobody does that. And so we realize that, for those types of physicians, the physicians that are coming out that really are insured, banks, when you factor in the interest rate is kind of the lure, right? Prime minus 1. Fuck, it sounds amazing. Well, prime minus 1 over a 20 to 40 year period, when you're paying a monthly maintenance fee, when you're paying your service charges, when you're paying all of the different fees that go with the term loan, you amortize that out, that is somewhere between 40 and 60%. It's a huge amount of money. In our model, we actually, if you use our cash, if you use our claims service and our dashboard service, we put the cash flow in for free. Like it literally costs no more to be able to implement it. And it's done like that so that you work on a Monday, you have cash Wednesday, you can pay for whatever it is that needs to happen between now and the 15th. You don't have to keep tapping that operating line. You don't have to keep using the Visa card at 20% or, whatever it is. And, you can start to get your cash flow right. If you pay off those debts fast, like just fast, just pay them down as quick as you can, you save a huge amount of money. And even though it seems like a small amount monthly, it's a small amount monthly that isn't helping you generate income. So it has an opportunity cost, and it has an opportunity cost for years and years and years and years to come, right? When you think about it like that, we work with one client, and they're fantastic. They're also on Cherry, and I think they're going to come on the podcast at some point soon. Yeah, the MedVisit group. They have a totally, and there's groups like this. You can call them and say, I'm a GP, I'm an emerge doc, I'm looking to be able to see patients, do home care visits. The pay is fantastic. The cash can come in very quickly. You can take the money and use it for whatever it is that you need on time. when you're making your payments on time and you're not using your operating line, your credit score improves. When you're being able to use those extra dollars to service the debt that you have instead of letting it just ride for 20 years, you save a ton of money. And if you have that debt available, you can use it to be able to generate more income. You can use it to be able to do things like tax deferment strategies and buy, investment properties or, fixed asset
Other
investments
things.
that end up cash flow. Yeah. Well, I mean, I don't know a lot about what you should be doing with it, but the reality is the low interest long-term debt can be a lot more expensive than people realize. And so, we're not asking if we can, mortgage your or finance your condo. That's not the business we're in. But the business we're in is at least in helping you understand, where your money is going. And that cost of that operating line over the long term is kind of like a loan shark rate, but you're just stuck paying it over 20 years.
It's a double-edged sword for sure. A lot of ski trips were enjoyed during medical school, but yeah, paying it back later now.
Well, there's something to be said for mental health, right? And however you decided to use the money, there's nothing wrong with going on that ski trip. But maybe the right way to do it or a better way to do it is work an extra day, make a few $1,000, and then don't blow the bank on the trip. Have a great trip. Make sure that it's done reasonably responsibly. Definitely don't break anything. Like I would never say go skiing, especially if you're a surgeon or you need to be standing all day. And then when you have that, when you have the income saved, then spend it. Or make sure that you're budgeting reasonably, right? So if an extra day of work is going to burn you out, then don't do it. But if an extra day of work is something that would really help you put another $3,000 to $6,000 into your spending allowance so that you can keep servicing your debt, or help you pay that off faster, or if you're recently divorced, you're just in a dynamic situation, don't put yourself in a harder situation because life happens. Figure out how to be able to manage the business smoothly so that you can at least keep that part of that core part of your life stable.
Wise words. Well, Ross, thank you so much for joining us today. We really appreciate the time. The depth of knowledge is clear, and look forward to engaging with PFF further in the future. Thanks again. Welcome anytime.
Yeah, thank you very much, Aaron. This is a real pleasure. Thanks for having me on.